Hi guys, my name's Dan, I'm a veterinarian, and today we're going to go over Parvo. I'm going to give you 3 things regarding Parvo, what the owners see at home when a dog has Parvo, how I go about diagnosing it, and how we manage it or treat it in the veterinary clinic. Parvo showed up in the mid-1970s. It spread very quickly, affecting domestic dogs. Parvo virus is a really resistant virus.
It can live for a long time, guys.
There's studies that say it can live, 6 months to a couple years in the environment. A lot of my owners, they're just wondering
Dan, I have no idea how we got Parvo.
Where have you been?
We walk on the block, and there's a lot of dogs walk on the block with us. That's it.
So even though you're not going to a dog park, you can still get Parvo from the adult population. Parvo is spread fecal-oral. I know. How is that possible? It has to be really hard. Not so much. For dogs, it's really easy. One dog poops, maybe we clean it up, but there's still some residue in the grass. Another dog walks over it, then licks their paws, fecal-oral contamination, we're done. We got Parvo now. So what does Parvo look like? The Parvo virus attacks the intestinal tract, the small intestines in particular. It really beats up the small intestines. It really does, guys. That's why Parvo has a very distinct look to it. Parvo virus has some pretty obvious signs. It causes extreme diarrhea with blood, and it smells horrible. You see lethargy, tiredness, and because the intestines are just so beat up from that darn virus, your doggy's gonna throw up a lot too, just from all the swelling and the nausea, and there's no appetite. So you have a really sick dog on your hands when you see Parvo. Parvo can develop just overnight. It does not mean your dog got Parvo yesterday. Parvo tends to sit in the intestinal tract for a week or so before it shows symptoms. Now, when I talk to my owners on the phone, when they're worried about Parvo virus, a lot of them are like,
well, how are we gonna test for this? This is gonna be intense.
So most of my owners are just really darn nervous about coming to the veterinary office because I'm not sure what to expect if a dog has Parvo virus. It's pretty easy to get a diagnosis for Parvo. Now, if we're positive, we're gonna run a handful of tests to see how stable your dog is or to give us a better idea of how serious things are. But we're going to do an ELISA SNAP test, testing for the Parvo virus antigen. Do a swab of your dog's butt where all that diarrhea is coming out of, because that diarrhea is just chock full of the Parvo virus. And we put it through a SNAP test, and it's going to tell us yes or no. Straightforward, yes or no. If it comes back yes, we have Parvo virus, we need to treat in the hospital. Comes back no, a lot of things, guys, can cause diarrhea. So that's where we run the test, because it could be a lot of things. It could be a parasite. It could be dietary. It could be stress. I mean, we have a puppy here. It could be a lot of different things. So it's good not to get tunnel vision. And that's why your veterinarian will run the Parvo test to rule it out, because it's one of those really serious diseases that if we do have it, we need to get started on right away. Now, what do we do in the veterinary office when a dog's positive for Parvo? Unfortunately, I know, I'm sorry, we must hospitalize your doggy. Hospitalizing your doggy means putting an IV catheter in, giving fluids, giving a handful of different antibiotics, giving antiemetics so we stop vomiting, maybe giving something to firm the stool up. Just making sure we don't get dehydrated, making sure we don't get septic or the bacteria overcome us, because Parvo virus starts it, the bacteria ends it. So we need to make sure that we don't get dehydrated and we don't succumb to secondary infections. With treatment, a majority of Parvo puppies do super well. So please, take a breath. A lot of them do good. So I hope that was really helpful, going over what you're going to see at home, how I'm going to diagnose it, and then how we're going to treat it. A lot of dogs will stay a few days in the hospital at the veterinary clinic. Once your doggy is eating and drinking, they usually go home, but that is always at your veterinarian's discretion. If this content is helpful at all, please like and subscribe. I really appreciate your support.